there, it's Monica Ross and Leslie Carson, and we are here to walk through our most recent Lunch and Learn that was held on August 8th, when we talked about IFSP services, including the service description statement. So, what we're hoping to do today is record the same information that we talked about a couple of weeks ago. So, those of you who weren't there have a chance to hear the information, or if you were there and you wanted to repeat, that's what we're hoping to do today. So, Leslie and I are going to be passing the torch back and forth and walking through the information.
And this is part one.
This is part one. A part two, this is the prequel. Yep. So outcomes today, what we're really hoping to talk about are a couple of things. There was a most recent, a couple months ago, we received some information from KDHE regarding our IFSP audit. And what KDHE looked at this year was specifically service frequency and the description of services. So we're going to talk about the strengths and some areas of growth that came out of that IFSP audit. We're going to talk about really what does research say about frequency and early intervention? How often do you need to be in front of a family to establish rapport and relationships? And most importantly, making progress towards outcomes. You'll have a chance to see some individualized description statements for services. We would love to say that we're going to practice writing those today, but there would be a lot of silence. Leslie and I would be staring at one another. We don't really want to do that. So we'll show you some examples, give you some prompt questions as well to help you hopefully get started on that road. And then we'll talk about really making recommendations for service frequency. When we want to do that, what considerations do we need to make? And then also at the very end, just, putting the ball in your court. What, based on the information that you heard today, what are you willing to hold? What are you willing to try? What are you willing to put a pin into so you can circle back? And if you can say, I'm doing all of these things already, well, then you probably should have been doing the presentation, not Leslie and I. Right, Leslie?
Yep, I agree.
Awesome. Okay, so Leslie actually helped gather the information for the IFSP audit. So I'm going to punt this one to her so she can talk through some of the strengths that they found in our program, but also across the state.
Yes. So some of the things that KDHE found in that IFSP audit. The first home visit is being completed within the first 1 to 2 weeks after the initial IFSP, which is great. KDHE would really like for that to happen within the first 30 days, and we're knocking it out of the ballpark within the first 1 to 2 weeks. So, yay! We're doing a great job documenting family service coordination between that initial IFSP and those first home visits. There's different disciplines are selected, so it's not just, a speech pathologist or an ECSE, but a variety of different disciplines for family service coordination and that primary service provider. We're doing a great job of documenting welcome to the programs, coaching, quarterly updates, peer-to-peer, so that teaming process, and then confirming visits. There was great documentation for that. And that communication overall with families between visits is a real strength. So great job.
Lots of good things that came out of that. And again, what I loved the most that KDHE had not done before was they give a lot of individual feedback to programs, but they've never said, hey, here's a sneak peek at what's going on around the state. They've never identified trends and patterns across all the programs. And they did that this year, which I thought was really exciting. So, Leslie, how do you feel about talking about, again, some concerns, some patterns and trends that Kansas has noted regarding service and service description on the IFSP?
Yeah, I can do that for sure. So some of the things that they noticed across the state were that some visits from the primary service provider are less than 60 minutes long. If there are multiple children, so siblings, twins, triplets, things like that, that 60 minutes of intervention is often split between siblings or multiples. We might be scheduling some visits for once or twice a month. So it could look like, you know, two, 12 visits for 6 months. So families are getting once or twice a month, which makes it hard because if a visit gets canceled, then that family is really only receiving one visit a month. So that frequency intensity, I guess, across the state is not necessarily individualized for the child that is receiving the services. And so if the service frequency isn't individualized, then the description of services isn't individualized either. And families are, um, you know, how do we help families remember what it is we want them to practice in between visits? What are we doing to help them be successful in being able to, practice the strategies? So that's something that we want to work on.
Absolutely. And I'm thinking about when we were live, right? And we had a group of 60 therapists. I'm thinking about some of the questions they asked, and as we're reviewing the concerns, one of them was, where does the 60-minute visit come from? And why is that kind of the standard? So, a couple different reasons for that. One is after doing quite a bit of research on how long it takes to walk through a home visit when we're reviewing those parts. Again, reviewing the previous joint plan, setting up activities, joining activities, doing the observations, the modeling, the reflection, and debrief. That takes about an hour. One of the things that we talked about is some children we know can't tolerate an hour. That's too long. Sometimes we go into childcare centers and an hour is too long. So it doesn't mean that you have to see a child for 60 minutes, but if we're not, and if we're seeing them for less, we need to be documenting in that description why. Why are we not doing that hour-long visit? Again, it's okay to not do it, but we need that documentation. Um, the other piece that I want to pop down to is speaking of the documentation, speaking of what Leslie talked about with the service description statements not being individualized. At Johnson County, we created this really, I think, quite lovely service description statement, probably 8 or 9 years ago, that describes basically the model, the service delivery model. Has 7 steps of what services look like and how we're going to coach the families, and that's great. But again, it's not individualized for the child. So moving forward, delete that service description statement from your sticky notes. We're not going to be using it anymore. And instead, we're going to take that service page and we're going to walk through again some prompt questions so you can describe in more of a narrative what's going to be happening. That service page can be super confusing to look at. It's a chart and there's all sorts of columns and rows. And so, again, it's not a very parent friendly way to understand the services. So that's why we want to use that next spot, that next paragraph to do that. So, yeah. So these are definitely, and Leslie, again, I keep punning this to you, but Leslie actually, prior to prepping for this, she had pulled, I say we, but I really mean Leslie. Leslie had pulled an initial IFSP from every service provider. We wanted you guys to have some initial feedback before we walked into this. And one of the patterns we did notice is that a lot of our families at initial IFSP are receiving between 12 and 14 visits in 6 months as their service frequency. And so again, thinking about that is, less than, that's less than 3 times a month, 2 times a month at best. And then like Leslie talked about, if cancellations happen, it's even less services, and that's at the start. So again, these are just things that were noticed not only with our program but across the 29, and I felt like those were important things that Leslie and I share with you too. So talking about, I think one of the purposes is, why are we doing what we're doing? Why are we providing early intervention? What's the purpose? And the number one purpose of why we're providing special education, early intervention services is to make progress towards the outcomes and towards development. Yes, we want to establish relationships with the parent and child. We know that takes time, and we know often that relationship needs to be established before we can make the progress towards the outcomes. But one of the things, again, I think we need to think about is um, are you providing a level of service that will help a child make out progress towards the outcomes? We've looked at other programs. We've talked about this a little bit here and there, but there are 11,000 children, a little over, receiving services, early intervention services in Kansas. And so if every one of those children, or a vast majority of them, are receiving 2 times a month, Leslie and I would ask the question, is that individualized? One of the things we had talked about in during the lunch and learn is that oftentimes we know medical providers, private practice generally see a child once a week, and we may or may not have strong feelings towards that. But if they're seeing every child every week and we're seeing every child every other week, we're doing the same thing that they're doing. We're providing a scripted type of service. We're just seeing the child less than them. So again, what we really want to do is encourage you to think about the services that that child needs to make progress towards that child's outcomes. Leslie, you and I have talked about too, like programs like Parents as Teachers, Early Head Start, Healthy Families, which are generally programs for children at risk, or typical developing children. And again, depending on where you are, Parents as Teachers may be seeing a family once or twice a month. Sometimes up to 4 months, again, depending on what county you live in. Early Head Start generally sees a family every week for at least 60 to 90 minutes, and Healthy Families also sees families weekly, typically for an hour. And so, a question to ask ourselves is, if those programs are seeing children on a 2 to 4 month basis, if they're providing services to that child and family 2 to 4 times a month, and that child is at risk or typically developing, why are we providing less services to children who've been identified as having developmental delays and disabilities? Again, and the answer to that question is 19 different things. But I think it's really, really, really important that we remind ourselves, again, what our purpose is, and ask the question, what do we need to provide or suggest to this family, especially at that initial IFSP, to get started? Leslie, what about this kind of serve and receive? Like, what about that relationship building? I feel like that's where, again, you've done a lot of work through this, through ABC, through More Than Words, and talk a little bit about how that really impacts early intervention services too.
Well, it's a relationship. Um, a relationship that we build with the caregivers, that we build with the child. I'm going to say we need to get in there and get to know these families, doing an evaluation. We receive a lot of information, but really starting to get in there, build that relationship. You're in there frequently. You can observe a lot of things, get to know their routines a little bit more, get to know what some of the challenges are. They may have shared some of that with you during that evaluation, but that next step and being able to for the families to get to know you also, right? So that's that serve and receive. And again, as you said, Monica, it doesn't have to be 60 minutes if that's what is decided on, but you can build that relationship, that rapport and trust as you are, the more frequently you're seeing that child and that family. um, Again, we are working with adults. I mean, we're working with the child, but we're working with their caregiver. And there, as we're going to talk about later in this presentation, just many, many factors that are we should be considering when talking about frequency. But the serve and receive is really important. Working together, building that rapport, and we do that by starting off seeing families more frequently, so we can learn about them and support them with.
Absolutely. And I don't know if you noticed, but I took a sip from a cup. Yes, it's a red solo cup. Yes, it has water in there. So if you're just wondering, I forgot my fancy Stanley at home, and so I am using a solo cup, not to be confused with a party, a social gathering of people. This is a work event, right, happening right now.
Hmm.
So let's talk about the F word. Um,
Hmm.
Leslie, do you have any guesses with the F word? I mean, an early intervention F word. What is our F word?
I'm going to say frequency, but also an early intervention. It could be fun, but I think today we're going to be talking about the word frequency.
Yes, yes, that is the F word of the day. I feel like a Sesame Street lesson right now. You have to identify your word of the day. But one of the things we really want to talk about is frequency. And for those of us that have been here for longer than we want to admit, 15 years ago when we were rolling into the primary service provider model, one of the things that we were not discouraged to say, but we found other ways to talk about frequency. We talked about dosage. We talked about support. We talked about, Leslie, what are some other words we've used to describe this in the past? Bursts of service.
How often? Oh, yes, burst of service.
Mhm. Yes.
Yes, that's a
Front
great
loading.
front loading.
Yeah.
Yeah,
Yep.
front loading
So,
versus service. Yeah.
yeah. So there's lots of different ways to talk about frequency. But really, what we want to do is we want to use the terms and the words that families understand. And so, again, not when we say to a family, oh, your child qualifies for support, my question is always going to be, does that family understand that you're saying the child qualifies for early intervention services? Does the child qualifies for, again, physical therapy, occupational therapy, speech therapy, nutrition services? So, we take pride, and I think we do a great job of meeting a family where they are, but yet we talk around things that I think can add to the confusion. And we all know special education is confusing enough, right? I mean, you got a PWN and an IFSP and a PDQ and an ASAP and all these acronyms anyway. So what Leslie and I want to do is give you permission to use the F word. Say frequency. If it helps a family understand what we're talking about, let's go ahead and do that. Those of you who know Dr. Tina Payne Bryson's work, she has a strategy of name it to tame it. And so, again, we've talked around frequency. We've been afraid to use it. It's part of the IFSP. We talk about that intensity. We talk about how long we're going to be working with the family. And we want to make sure that, again, families are aware and understanding what we're talking about. So, again, using the description, right? The description of the very definition of frequency is the rate at which something occurs or is repeated during a particular period of time. So again, thinking about our services, Leslie, when I say to a family, oh, we're going to see you 12 times in 6 months, what does that mean to a family?
Don't know. Oftentimes families have lots of things going on. Maybe there's many siblings at the IFSP meetings. So I don't know if it were me, I may not be able to ask right there in the moment. What does that mean? I'm just like,
Mhm.
oh, okay, yep, that sounds good.
Yeah, yeah. And I'm thinking, like, as a parent, I'm thinking 6 months, like my child's 6 months old now, and they're going to be 12 months, and I'm only going to see you 12 times. I think I use the example of when we talk about frequency of services, it's like nailing jello to a wall. Like we don't want to commit to anything. Well, we might start with this and then we'll move to this. And again, I feel like it's this like magic show, right? All smoke and mirrors. But again, we're thinking about the initial IFSP. We're not talking about annual, we're not talking about review. I really want you guys to think about that initial IFSP period. Question that we asked the audience a couple of weeks ago, and we'll ask you guys today is, you know, yeah, ask yourselves, yes or no to these questions. Have you ever seen a child once a month? Yes or no? Have you ever seen a child twice a month? 3 times a month? What about every week? Have you ever seen a child more than once a week, maybe 2 or 3 times a week. The reason we asked that question in the group is because everybody raised their hand when we had the low frequency, the once, twice a month. But as we increased the frequency to once a week, twice a week, 3 times a week, hands were going down in our group. Um, and again, not right or wrong, but we just want to ask, have you guys ask yourselves why? Why are you not seeing children at different frequency levels? And Leslie, do you remember what some of the therapists talked about when we asked them? Like, what's the barriers, right, to providing more services? Like, what are the real things therapists are dealing with?
One of the things I remember somebody saying was, can I do that in my schedule? So thinking about the schedule, is that something I can do? I I don't want to tell parents I'm going to do it or write it down if I can't do it. So I
Mm-hmm,
feel like that was something that was discussed quite
mm-hmm.
a bit.
Yeah. And I think that's always the big one is, I'm carrying a caseload of 40 kids. I'm,
Mhm.
already doing 23 visits a week. Like, can I provide that level of frequency and, deliver? And I love that that was the question that was asked because again, that tells Leslie and I, you guys want to do what's right for the family. You want to do what you're putting down on a piece of paper. So again, we're talking a lot of utopia, but Leslie and I haven't been a therapist in a while, you guys. In fact, Leavenworth Infant Toddler has put me on the B team. I'm not even on the A team. I'll volunteer to help with an eval, and they'll be like, okay, anyone else? So again, I've been demoted to the B team, but Leslie and I have both provided services, and so we do understand that frequency of service is a big thing when you've got 6 therapists out on maternity leave, when we're short staffed, we've had teams that have, been down a therapist for over half of the year. And so these things are real challenges that you guys deal with every day. And we don't want to discount that. Again, a lot of this is not to say we're doing things right or wrong. It's just to start asking ourselves questions. Are we doing right by this child? Are we recommending a service level that fits what this child is going to need to make progress based on our professional opinion? Leslie, you've been assistant director for a couple of years. Has any therapist ever asked you about frequency of services? Hey, can I see this child once a week? Can I see this kid once a month? Have you had any conversations like that with therapists yet?
I have not had anybody ask about once a month. I have not had anyone ask about twice a week, or I haven't had personally those conversations, but Monica, I know you have. So why don't you share with us, like, what is the most common question you feel like you've been asked about frequency?
Mhm. I think the most common question I've been asked over the years is, this family really wants more than once a week, or I really want to see this family more than once a week. Is that okay? And my answer is always going to be yes. I personally do not know what level of frequency a child needs to make services. I haven't been a part of the team meeting where we talked and presented the child. I wasn't at the evaluation. I wasn't at the, kind of as you're generating your draft. And so, my question is always going to be if it's appropriate for the child, absolutely. We can provide services more than once a week. No one has ever asked me permission if they can see a child once a month or twice a month. And so, what I want you guys as therapists to do is you don't have to ask me permission to provide services for a child. I'm always going to support you. Recently, we had a physical therapist reach out because she had a family that she started working with. And the family was very anxious about their child's development. They were anxious about getting going. Mom had shared with the physical therapist that mom wanted to do twice a week. And dad had even offered 3 or 4 times a week might be a good place to start. And so the therapist reached out and we talked about options. And, one of those options was maybe you're providing services twice a week for the first month So on that service page of the IFSP, you're going to write, twice a week for a month date range. And then you're going to write another line of service as a physical therapist for the next 5 months. That's maybe once a week. So, again, helping that family feel a little less anxious because we're putting on paper, yes, we're going to see you twice a week for this first month, and then we can reconvene. We also had an early childhood teacher that when Leslie and I were pulling IFSPs, I pulled one of them and I was like, hmm, because on the IFSP, it literally said she was going to see the child and family 3 times a week for 15 minutes for the first month. And then for the remaining 5 months of the IFSP, she was going to see the child 3 times a month. And so I emailed this therapist and I was like, did you need to do this? Um, and she actually responded yes. During the evaluation, the child had a very, very hard time, lots of tears, lots of anxiety. And Judy, well, I just used her name, Judy Cannon, felt like it would be in the best interest for the child to establish rapport with her if she was doing a lot of frequent check ins initially to get going. And so she did that. She put that down, and I had never seen that before. But again, Judy didn't ask me permission. She knew that was what that child needed to have to make progress towards the outcomes and to, again, get a relationship and rapport built with her. So, again, lots of great examples. Um, but one of the biggest things I think I hear too is, oh, that's not our model. We don't provide services more than once a week, or, we don't do visits after 5. And in special education, one of the worst things that you can do is just flat out say no. And I know you guys don't want to hear that. I don't like to hear that either, but we have to consider everything. Again, if a family wants to visit at 4, we can't say no, but we might be able to say, hey, I can do that once a week, or, and the other visit a week, can I go to childcare? Can I go to grandma and grandpa's? So, again, how are we working with that parent and that child and that family schedule and situation to make sure, again, that we're offering a frequency level that makes sense for progress, but also makes sense with your schedules too. And again, we only have 5 4 o'clock visits a week. There's finite amounts of time for sure. So, Leslie, I'm going to put this one to you. Talk with us about over the last 15 years, how is this particular slide and the information on the slide, how has it ebbed and flowed, right? Because again, those of us that were here in 2010 absorbed information that's different than what we're saying now.
Right. Well, I think in 2010, it was a whole new learning curve, an introduction. I can't better plan that today. Introduction to coaching. And I think it's ebb and flowed because that is the adopted word that we've been using to talk about services since 2010. However, the service delivery model that we use is the primary service delivery model to teams. So that's the service delivery model. And in that includes our team meetings, our joint visits, all of those different things. Coaching is the interaction style that we use with families, with caregivers to find out what they know so we know what to share. And it's not our model. It doesn't determine anything about frequency or how we write outcomes or anything like that, services, who's on the service page. Those things are determined through conversation and the child's development, whatever the outcomes are, whatever is going on for the child and family. So I think there's been some confusion, maybe some different interpretations about what our service delivery model is and what coaching is. But I think we want to just make sure everybody understands that we're providing primary service delivery model and we use coaching as the way that we interact with caregivers.
Mm-hmm. Absolutely. And we know coaching looks different for every
Yes.
person and every family.
I would say that in and of itself needs to be individualized also to meet the caregiver's learning style and all of the different things that we take into consideration when we're working with families.
Hmm. I think so too. I was coaching my daughters who are now 20 and 18. I coached their volleyball, let me clarify, recreation volleyball teams from like third grade to eighth grade. And when I think about coaching and what we do with families, again, having it be different and individualized for the family, I often think about my coaching experience with these volleyball teams. And, a group of 10 girls who have never played volleyball before, which I often think about, that's where our families are, right? They've probably never had intervention before. So we're kicking things off. And there were some girls on the team I could model the drill with them. They would watch me and they could run off and do it, and they could do the drill with minimal check-ins. And then I had a group of girls that they needed models. They needed maybe to practice with me a couple of times, and then I could pair those girls together because I knew they were about at the same skill level. And then I had players on the team who literally needed me to help them hand over hand, get a platform for a pass. They literally needed me to be their partner for like 4 years because the ball would just go everywhere. Meanwhile, that group of girls that ran off and is practicing on their own, they're already working on overhand serves and jump serves, right? And I'm still working on passing and creating a platform. So, again, what we want to do is just understand that parents are going to run with it at the level they can run with it. And so if a family needs more modeling, if they need more examples, give that to them. We want to ask questions to get the information. We don't want to ask questions just to ask questions. That's not helpful. And we want our services to be helpful. So if you ever really need to think about that, just imagine coaching a group of 10 trying to teach them a new sport or new activity. It's pretty amazing watching them. Oops. So the more you know, we want to talk about when should we discuss services? When do we start talking about them? I asked this question during the lunch and learn, not realizing I actually had the answer as the second bullet point. But we talk about services after we write the outcomes. We don't talk about services at team meeting when we're presenting a new referral. We don't want to talk about services at an evaluation in terms of exact services because we don't have the IFSP outcomes written yet. We don't have the information on that child. So again, write outcomes first and then write services. So one of the things that we've talked about is when you have a draft IFSP, that service page should be blank. If you write information on the service page, including names of you or supporting therapists or locations, that's called predetermining services. And it is not anything that we want to have as part of our regular practice. So again, that frequency, that service page should be completely blank, and you create that with the family after the IFSP outcomes. Now, if someone said, well, if I know I'm going to be the family service coordinator, can I write that in there? My question would be, have you predetermined services without the parent's knowledge and consent? And if the answer is yes, delete the line of service and just wait until the IFSP meeting so you are filling that out together. Leslie, what things do we need to consider when we're talking about IFSP frequency?
Want to take into consideration what the family or caregivers needs are. There's many different factors that would impact or affect that frequency of service, and then certainly the child's needs. Again, these two things are individualizing that frequency of service. They're individualized to the family, the child. So those are the two main factors that we need to be considering and pausing and asking ourselves questions about.
Yep. Let's talk through those kind of family and other caregiver considerations. Again, it doesn't mean families need more or less. Again, what are some things about the family and caregiver piece that we need to think about before we're really recommending service levels?
Well, one question, how many adults are supporting the child and where are services taking place? Are we needing to provide services in the home and at childcare? Those are some considerations. How many outcomes do we have on the IFSP page? If we have 8 or 9 outcomes, that's going to impact the frequency of services that, or we should be asking ourselves, how are we going to make progress? What frequency of service do we need to be considering in order to address that? Age of caregivers, looking and education level or cognition. Do they have any other risk factors? Is there maybe some trauma, different family dynamics? All of these things we want to be asking ourselves, and how does that impact, or we need to consider when we're talking about frequency?
Mm-hmm.
Has the caregiver or family member had experience with Part C special education services? Are they more experienced with clinic based? What do they know? And then what is the confidence level of the caregiver in supporting their child? So all of these things we want to be asking ourselves and taking into consideration.
Mm-hmm. And I love this one of, age of caregivers, because when I
Mhm.
first read it, I was like, parent, if the parent's 18 or younger. But as I get older, Leslie, the workforce gets younger. And what I've noticed and what I'm hearing when we're sitting in team meeting talking about supporting our children who are attending childcare centers, we have some young childcare teachers who are in classrooms with infants and toddlers. They may be 20, they may be 21. And so, again, thinking about that age, that level of confidence, and what can we do to support our childcare teachers. So it's something that I feel like we've been talking a lot about since COVID. And it's just so important because, again, I'm going to throw this out. If we're seeing a child twice a month, once a month at home and once a month at childcare, you're going to go you're going to go a whole another month before you see that teacher again. And my question is going to be, is that enough? Is that enough support for that teacher to feel confident and competent in working the strategies? And we know childcare visits can be tricky and tough. We know that sometimes you're not going to have the same teacher. You're going to have transitions. Children move classrooms. So, again, it's just another layer, I feel like, with service provision, but definitely important things to think about. What are some child factors? We talked a little bit about that, Leslie. Again, what are some things we need to think about with children when we are thinking about considerations for service frequency?
Well, I think it's always good to think about, I'm going to jump around on the slide, but what were the physician recommendations or the doctor or pediatrician's concerns? Um, I'm going to jump to, if a child is entering services and they're 2.5, or, I'm going to say 32 months, they have a really short time to receive some Part C, special education services. So we want to take that into consideration. Again, how many outcomes did we write with the family? Diagnosis, any medical, I'm going to say, or health concerns that will impact. What areas is the child delayed in? And I'm going to say number of children with IFSPs in the home. So we talked about that earlier in this presentation. When you're providing services for siblings, multiples, things like that. These are all things that we want to be thinking about and asking ourselves, how do these things impact the ability for the child that we're seeing to be able to make progress on the outcomes that we wrote?
Mm-hmm. And I think this one where age of child, again, you think about a child entering services when they're 12 months old. That child is 24 months to potentially receive services from us. Whereas if we have a child who's 30 months old, that child has 6 months. Again, that's a significant decrease of time. And so sometimes out loud, I'll hear people saying, well, by the time we write the IFSP, well, we're only going to do a couple visits. And I'm thinking, or you could do a lot of visits if you think that child needs that to make that level of progress that we would like in that 6 month period. So again, we want to really take that into consideration. And the other one I love talking about is with how many opportunities for engagement. We had a presentation a couple years ago, and one of the activity settings we specifically talked about was mealtime. So if you're working on strategies for feeding, for swallowing, whatever that mealtime looks like, you think about a child typically having 3 meals a day and 2 snacks. So let's just say for easy math, that child has 5 opportunities a day to practice with that caregiver those strategies for mealtime. And if you, as a provider, are teaching new strategies to that caregiver, whether it's a parent, childcare provider, and you say, okay, I'm going to come back in 2 weeks, that's 14 days times 5, which I believe is 70. If my math is correct, that's 70. Leslie, do the math while I'm talking. 14 times 5.
I'm pulling it up.
Okay. But that's 70 times. Yeah, you know what? The math is possible. That's what I'm saying. But that's 70 times in that 2 week period that caregiver is going to have an opportunity to practice those strategies before you come back. And so, again, the question is, are you comfortable with that? Do you have confidence in that care provider that they're not going to have questions in 10 days? Sometimes we say to a family, well, when do you want me to come back next? Well, again, do the math and say, hey, between now and 2 weeks, you'll have 70 opportunities to practice mealtime. You feel like you want me to come back next week, check in with you in a couple of days. Again, let's individualize that service frequency for what makes sense for the outcome and what makes sense for the child and caregiver. So, who would have thought 70, if you're eating 3 meals and 2 snacks a day, at 14 days, that's 70 meals. It's a lot of
It's
meals.
a lot.
It is a lot. So over the course of Leslie and I have been talking, one of the things you probably heard us say is recommend services. And chances are high when you heard us use those words that you went, oh, what do you mean recommend services? We don't recommend services. 15 years ago, we were taught to ask a family during that initial IFSP meeting to ask the question, how much support do you think you might need or want over the course of the next 6 months? We talked, I think in the lunch and learn, I gave the example, how you have you like pick up lines or whatever. So I think the line that I said was in regards to that question, how much support do you think you might need or want in the next 6 months at the initial IFSP? Take the motto, I lost your number. I lost it when I hit delete. Like starting now, don't ask that question at the initial IFSP. I gave the example also of my brother who about 4 years ago started taking some medication to help treat his diagnosis of schizoaffective disorder, bipolar type. And at the time, if the doctor had said to me and my brother, well, how much medication do you want to start with? I would have been like, Kyle, let's get out of here. I would not have been confident at all that this doctor knew what they were doing. And so I think that we need to embrace our professional skills, our training, our knowledge, and we need to partner with the family to figure that out. But one of the things Leslie and I really want you guys to start doing is to provide that starting point. So when it's time to talk about services, instead of asking the family how much support they want, again, maybe they didn't even know their child was delayed until, 2 weeks ago. Let's go ahead and make a recommendation. Let's go ahead and say, hey, based on the information you shared today, thinking about the 9 outcomes that we wrote, thinking about how your child's 30 months old, I would recommend at starting off with 6 times a month. Again, some weeks you might be going 2 times a week, some weeks you might be going 1 time a week. And then ask the family, how does that compare or contrast to what you were thinking? How is that similar or different? Scripts are based on your child's priorities, based on your priorities for your child, based on your outcomes. I would recommend we start off once a week for the first 3 months, and then let's regroup and see where we are and see, if that level of service is going well. And if not, we can talk about increase or decreasing. How does that feel for you? Um, I think it's so important that we make that professional recommendation and then provide the family an opportunity to share with us. And the family might be like, yeah, that sounds great. Or Leslie, the family might say,
Uh, I wasn't really thinking that based on like my work schedule and Johnny's appointments. I was thinking maybe, twice a month, or maybe you go to daycare 3 times a month. Maybe I can meet with you once a month then here at home.
mm-hmm. And guess what? That's perfectly okay. Perfectly okay. We're going to talk in a couple slides about how to document that information in the service description when we're talking about frequency of services and it doesn't match what a family was thinking. Um, but I do know sometimes when we say to a family, how much support would you want? The family's like, well, twice a week. And you were thinking 3 times a month. Or you were thinking twice a week and the family's like once a month. So I feel like sometimes we're asking these questions that give families these unintentional choices without all of the information they need. And that information includes our professional recommendations. So again, we want to give that back to you guys. It is perfectly okay to make recommendations and then check in with the family on how and what they were thinking. Um, one of the pieces we talked about earlier, Leslie talked about was writing services for siblings, twins, triplets, quadruplets, quintuplets. Um, what do we see on IFSPs, Leslie, when we look at those in our program?
Uh, One child receives 30 minutes. Child A receives 30 minutes. Child B receives 30 minutes. Child C, child D. Usually 30 minutes is what I have most frequently I've seen, which is determining services for the group or the number of children versus the individualized the child individually is what I'm trying to say.
Mm-hmm. So again, this kind of goes along with that recommendation of services. The family that has multiples, they may say to you, I mean, I don't think we can handle more than 1 hour a week. Or based on your recommendations, yeah, it would be great for you to come twice a week, but we've got a lot of medical appointments. And so again, working that backwards, but what we don't want to do is take 60 minutes and divide it equally among the kids. We know that children develop at different rates. And so you're going to have child A who may need less services and child B may need more. And it's okay to reflect that on the IFSP that, it's okay if one twin A has, 45 minutes 3 times a month and twin B has 60 minutes 4 times a month. We're providing services for the child. And again, we're not dividing minutes between siblings, if that makes sense. It's hard. I think it's hard, right? I mean, I just
It
said
is.
a couple slides ago the math is possible, but then we get to this slide and the math is hard.
Yes.
Mm, yeah.
So
One
my
thing you can do, I know that again, we usually write services for a 6 month period. You can write services for a 3 month period and then do an IFSP review at 3 months because you're going to have more information. And then you can, again, individualize it a little bit further. So we have to legally review an IFSP every 6 months, but we can do them more often. And that initial IFSP to 6 month window, I feel like is so tricky because At the 6 month review or at the annual, families have been in services. They understand what it looks like. You can say to them, hey, at a 6 month review, we planned for 3 times a month, but we only ended up doing 2 times a month. How did that feel for you? And if the family says, great, again, that gives you a starting point to work off of for that second 6 month period. But that initial IFSP period it's hard. Traditional therapy is a therapist and the child, and it looks very different in the home. And so we want to make sure we're giving families a lot of time to figure out exactly what it is we're doing. And Leslie, trick question, but how long is the front loading period after initial IFSP
Three
based
to
on
six.
research?
I'm sorry, what did you say?
How long, when we say, oh, well, front load services, what period of time should we be considering that front loading period?
We need to be considering that front loading period 3 to 6 months. It's take, families need the opportunity to understand uh, what what it is they kind of signed up for. And it takes 3 to 6 months for families to really get, be able to probably maybe even process that their child had a delay and the relationship and building that serve and return or serve and receive. So that's the period of time that we should be considering before we're decreasing services. And as you
Mm-hmm.
said, if we're doing that 6 month review, that's a really great time to talk about that frequency of services again and um, use the information over the past 6 months to start the conversation with families.
Mm-hmm. Yep. And again, I'm referencing a lot of, 15 years ago when we started, what we learned was front loading means you see them weekly for 4 to 6 weeks, and then you go to every other week. And our question is that individualized or is that a script? And if that is what you're doing for every child in your caseload, that is a script. And again, we want to individualize the services. So we want to give you guys back the reins to make those decisions with the family based on what that child needs. So talking about again, when do we decrease services? Leslie just talked about that might be after that front loading period of 3 to 6 months. We might have a parent or caregiver that says, hey, this is too much for me, something has changed, a work schedule, a family dynamic, and we need to decrease services. We might also have a parent or family that's, again, they're over in the corner teaching themselves how to jump serve, right? And you are working with them on underhand serving and passing. So you're going to have children and families who, feel a lot more confident and competent with embedding those strategies, and they may need you less too. If a child isn't making progress, that's when we have to ask ourselves, okay, what needs to change? Do we need to increase the frequency of visits? Do we need to increase the length? Maybe we were only doing 45 minutes. Maybe we need to go to 60. Maybe we're doing 60 minutes. This child and family need 90. Maybe we need to do more joint visits. So again, lots of different questions to think about and to ask yourselves. But the bottom line is, again, remembering the purpose of early intervention, which is to make progress towards outcomes and development. And so we want to continue providing those services that do that for a child and family with our professional recommendations, hopefully, again, and then matching that with what the family was thinking or wanting. So the last big part of this service part one is really looking at our service description statements. And this is just a quick screenshot of the service description and how they're going to be delivered. And Leslie, this is where we've been copying and pasting this beautiful statement with 7 steps and, everybody, and we might change the child's name to individualize it, but it's pretty much the same. So this is where we want to talk about deleting that. And we want to talk about describing what the services are going to look like using parent friendly language. And so what Leslie and I did was we have been thinking about this for several months and thinking about what questions should we ask ourselves as we're creating the service description statement. And Leslie, would you want to talk through some of those questions we feel like are going to be helpful for the therapist to think about?
Yes. So again, we're writing a service description statement so the family understands that service page. And that starts off with who is that primary therapist or the provider that's going to be working with the family. So outlining who that is and what their discipline is, who is the family service coordinator, and how are they going to be providing the family service coordination, how often. So again, that frequency, we're going to break it down and write it in using language that is really family friendly. How many visits per week, per month, how many minutes potentially, where are the services going to be taking place? Are they going to be with grandma and with at home? Are they going to be at childcare? Are some of the services going to be with the nurse, the in-home nurse? If we're not seeing the parent during the visit, how are we going to help the parent remember or communicate with them to know what are the strategies, what is the plan that we're working on, or maybe grandma's working on? We'd like for mom and dad to be aware and potentially be able to work on too. So we want to outline all of that um, and and in a family friendly way so that um, we can understand that's really that service page, which can be confusing.
Mhm. It is. It is super confusing. And again, lots of open-ended questions for you guys to think about asking. And what we did was put together an example. And this example would be if Monica, ironically my name, also my discipline is speech therapy. I don't know how that happened. Um, I might have on that service, I'm thinking on that service page, I would have a line of service for me as the family service coordinator. I would have a line for me as the primary therapist, as the primary service provider, as a speech therapist. And then I'm going to also have a line of service for Dana, who is a nutritionist for nope, I'm not going to have a line of service as I'm reading this. So it'll just be two lines of service, one for me and one for FSC and one for me as PSP. So how you might write that service description statement could be something like, again, I don't have to read this because you guys can all read, but describing I'm going to be the main provider. I'm going to help coordinate early intervention services. You can see in that second sentence, I'm going to schedule joint visits, communicate with medical providers, review the IFSP every 6 months. I took some of those starter statements that we use when we document FSC. I took some of those and embedded them in here. I've outlined on my service page, I might have 24 visits in an 18-month period. Again, we've talked about how families don't understand what that means, but here I've said I'm going to see Jack 3 times a month at childcare for 45 minutes and 1 time a month at home for 60 minutes. And the reason for that visit at 45 minutes was because that works better for the classroom schedule. I talked with the teachers during the evaluation. We talked about how long, it's helpful to have somebody in their classroom, and that's what they shared. Um, After I see this little guy Jack at daycare, I'm going to text the family to know how it went, what they're going to practice at childcare. Again, just to keep that communication line opening. I did document that during the initial IFSP meeting, we talked about adding nutrition, but the family felt comfortable with me consulting with Dana outside instead of doing joint visits. And then at the end of every visit with the family decided they're going to write a note and put it on the refrigerator to work on between visits. So again, a little bit more of a personal narrative that describes the services that are going to be happening at the initial IFSP. Now, chances are high that's going to change, right, when we do the review. So we're going to continue to update this description when we update services. So this is going to be something that we start updating every 6 months because we want to make sure this is current to the actual service page too, if that makes sense. Leslie, did that make sense to you?
Yes, it does. We want to put it again, family friendly, describe when we're changing the service page, we want to change the description of services so that they
Mhm.
match. And this is a more family friendly way to describe that.
Yep. So another example, if you're gonna put, and you can still put 18 visits in 6 months. You can still put, 24 visits in 6 months if you want to. You can also write 3 times a month, if you want that to be your frequency and intensity. Um, what we want to do in this part is, again, don't be like Jello, right? We don't want families to feel like we're trying to be deceptive or vague. We really want to spell out what we think the service is going to look like. Again, it might change and we'll update it and review it, but this I feel like gives a parent a lot more clear idea of what's going to happen, instead of saying, well, I think they're going to see me, maybe twice a week or twice a month in 6 months. So just some quick key points. Leslie, talk us through some, again, we tried to identify three big pieces to take away.
Yeah. Um, Poaching is not our model. It's how we interact with families. We want to make a recommendation for frequency of services for families during IFSP meetings. And I think the biggest takeaway is we want to individualize services, individualize for the child that we are seeing that the IFSP is for. So those are the three things that stick in my mind.
Yep, I love it. So, this is our last slide, and wrapping up, questions that we want you guys to think about is like, what is your takeaway? After doing the lunch and learn and watching this, or just watching this, what are you willing to hold, and what are you willing to implement? When are you going to start? And then whose help do you need? Do you have more questions that you want to ask your liaison? Do you want to ask Leslie and I? Are you watching this thinking, oh my gosh, this completely undoes everything I've been doing for 10 years, or this is not what they told me last week? So come to us with those questions because we know you're getting a lot of information and it can be from a lot of different sources. And so the purpose of what we're doing is trying to compile that information and we're trying to share it in a way that's purposeful for our particular program. So with that, Leslie, I'm going to stop sharing and I'm going to say thank you for doing this with me.
Thank you for inviting me.
Well, you set the Zoom up, you invited me.
Oh, yeah. Well, and it's Friday, so yay.
Yay. Okay,
Bye.
bye.